Welcome to the multiple choice question episode of the ASCO University Weekly Podcast. My name is Dr. Janice Dutcher. I am Associate Director of the Cancer Research Foundation of New York and Medical Oncology Co-Chair of the NCI Renal Cancer Task Force, and prior Chair of the ECOG Biologic Response Modifier Committee and Renal Cancer Committee. Today, we feature a question on the treatment of castrate-resistant metastatic prostate cancer. A 72-year-old man with metastatic castration-resistant prostate cancer has a rising prostate-specific antigen, or PSA, and multiple bone lesions on scan. He feels well and has no bone pain. He is fully active and working 30 hours per week in retail. He is particularly interested in immunotherapy, having read bulletins in a leading national newspaper. What do you tell this patient? A. Dendritic cell vaccine therapy with Sipuleucel T produced a survival advantage in a randomized clinical trial. B. The anti-CTLA-4 checkpoint inhibitor, ipilimumab, is approved for metastatic prostate cancer. C. Most immunotherapy for prostate cancer targets markers of bone destruction. Or D. Immunotherapy for prostate cancer is most effective in patients who are symptomatic. The correct answer is A, the dendritic cell vaccine Sipuleucel. Sipuleucel in 2 randomized phase 3 studies yielded a survival advantage compared to placebo in asymptomatic patients with hormone-resistant metastatic prostate cancer, with a 33% reduction in risk of death. Subsequent studies have suggested that the timing of Sipuleucel administration leading to activation of antigen-presenting cells was more robust in earlier disease states. The other choices presented are not correct for the following reasons. Ipilimumab was not approved for treatment of metastatic prostate cancer based on a negative phase 3 trial. The most recent targets for immunotherapy trials in prostate cancer include activation of antigen-presenting cells, checkpoint inhibition, and vaccines targeting PSA, not targeting bone. Studies subsequent to the phase 3 trial of Sipuleucel have suggested that it was most effective in the earlier patients with a lower tumor burden and less prior therapy for metastatic disease. This may reflect less immunosuppressive effects from the tumor or from traditional therapies. Thank you for listening to this week's episode of the ASCO University Weekly Podcast. For more information on the treatment of prostate cancer, visit the Comprehensive E-Learning Center at university.asco.org.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.